This video is an ethical and legal request for your informed consent. Before undergoing the medical procedure called endoscopic retrograde cholangiopancreatography, ERCP for short, your doctor wants you to understand why the procedure is needed, how it is done, and will explain potential risks, complications, and benefits associated with the procedure, as well as its reasonable alternatives. To help you better understand ERCP, let's start by looking at the body's digestive system. This system is also known as the gastrointestinal tract, GI tract for short. It includes the mouth, throat, esophagus, stomach, small bowel, and large bowel, which ends in the rectum. The upper GI tract is the part of the system that begins at the esophagus and ends at the upper part of the small intestine called the duodenum. ERCP allows doctors to look inside the body's digestive system through the use of an endoscope. It provides a limited view of the internal lining of the upper GI tract, but by injecting contrast into the bile ducts and pancreatic ducts with a specialized catheter, it provides detailed X-ray images of those structures. This is an endoscope. On one end is a camera that's guided by a set of hand controls with precise movements. Small openings on one end allow instruments, air, and light to pass through. The endoscope will be inserted into your mouth and guided through the upper GI tract. Your doctor will examine your esophagus, stomach, and duodenum on a monitor as the scope is advanced, possibly pausing occasionally to inflate certain areas with air for a clearer view. The most common reasons for ERCP include, but are not limited to, unexplained upper abdominal pain, stones in the gallbladder or bile duct, pancreatitis, jaundice, nausea or vomiting, abnormalities from other GI tests, suspected tumors or other obstructions of the bile ducts and/or pancreas. ERCP rarely causes discomfort. Prior to and during the exam, your doctor will give you intravenous medications to reduce anxiety and to provide sedation. These medications make it difficult for you to remember the exam. Sometimes general anesthesia is used, in which an anesthesia specialist will place a tube into the windpipe to facilitate breathing during deep sedation. Some of the risks of sedation include depression of reflexes, decreased breathing, and decreased blood pressure. Side effects and complications are rare but can occur during or after the procedure. To ease the scope's insertion, a mouth guard will be placed between your teeth. Your doctor may treat any abnormalities seen during the exam. If a stricture or narrowing of the bile ducts or pancreatic ducts is present, a dilator could be used to stretch the area. Samples of tissues, digestive fluid samples, biopsies, or cultures may be taken during the exam. Your doctor may treat any abnormalities seen during the exam. Samples of tissues, digestive fluid samples, biopsies, or cultures may be taken during the exam. If indicated, stones can be removed from the ducts. If a polyp is discovered, your doctor may remove it using a snare or biopsy forceps inserted through the endoscope or colonoscope. Because your GI tract can be seen so clearly, doctors can determine if further testing will be needed and develop a treatment plan for your diagnosed condition. ERCP is usually safe and associated with very low risk. However, you should be aware of any possible associated risks. Risks include pain and discomfort, a tear or perforation of the esophagus, stomach, or intestinal wall. Bleeding can occur from scope trauma, dilation, biopsy, or polyp removal. Pancreatitis. Other risks include loss of teeth, hoarseness, cardiac or respiratory complications, reactions to medications, infection, irritation or phlebitis at the IV site, possibility of missing a lesion or cancer, and other risks specific to your physical and medical condition as discussed with you by your doctor. Extremely rare risks include death, brain damage, disfiguring scars, paralysis, loss of function of an organ or limb. Because sites can be examined directly and with enhanced X-ray, ERCP is considered very accurate. Most doctors consider the results cost-effective with the least risk. However, there are alternatives, such as X-ray tests, scans, and injecting contrast into the bile duct with a needle through the abdomen. The decision to undergo ERCP is yours and should be based on your doctor's evaluation of your particular problem as discussed with you. If you decide not to have the procedure, be aware that your doctor may not be able to properly diagnose or treat your condition, which could worsen or possibly spread. If you have any questions about your need for this procedure or about the procedure itself, ask your doctor. This video can be helpful in your right to informed consent for ERCP, but should not be considered a substitute for discussion with your doctor.